My name is John Boerstler, and I serve as the Chief Executive Officer of Combined Arms here in Texas. And we wanted to reach out to our partners at the Veterans Health Administration, the United States Department of Veterans Affairs, and particularly the Michael E. DeBakey VA Medical Center right here in Houston, which is one of the largest hospitals in the VA system. And of course, in my biased view, one of the best in this system. And one of those leaders is Dr. Laura Marsh, who leads the VA Houston's mental health programs. And wanted to just welcome you, Dr. Marsh, and thank you so much for taking the time out of your day, especially during this incredibly busy time. I know you're seeing patients all day, every day, so thank you again for being with us today.
Well, thank you, John. It's a pleasure to be here, and I'm excited to be able to tell you what we're doing for veterans and to help them get through this coronavirus outbreak. So thanks for having me.
Absolutely. And Dr. Marsh has been involved with many of our endeavors here at Combined Arms for many years, or the past 4 years since we've been up and running. She has been a really active participant and leader, thought leader on our Wellness Collaboration Committee, and has spoken at numerous events. So she's no stranger to our systems. She's no stranger to our community. So thank you again, ma'am, for being on. So I wanted to really just start by talking about COVID-19 and the coronavirus. And we knew that this was going to be a stressful time for everyone, but specifically for veterans and their family members who might have already been suffering from combat stress or anxiety. You know, what has been your experience as the lead at VA Houston's mental health program in treating veterans and their families during this difficult time?
Well, we're just starting to treat them in the context of this, but we were anticipating that not only would the coronavirus outbreak be a problem for people and the stress with that, people would need to be quarantined, contained, but they also would have existing or pre-existing mental health issues that could actually get worse during that time. And our goal was to really ramp up what we were doing and to make sure that we could take care of the veterans seamlessly.
And what new innovative ways have you guys really been able to prepare in order to deliver those services faster, more effectively to veterans in this time?
Well, that's what's been fantastic and amazing. And we really have been busy. About 3 weeks ago, when we saw that the virus was moving into the United States and this area, we knew we had to have everyone ready to do virtual care, whether that's on the phone, whether that's with the what we call VA Video Connect. And then now the restrictions are lifted and we can do see people by Skype, by various conference calls, et cetera. And just to give an indication of how much people have moved into that, we saw approximately 1,200 unique veterans on Monday, just getting various kinds of mental health care. We saw 1,400 yesterday, and I think every day it's going to be more and more. We're doing same-day access. If someone needs to be seen, we can see them. We can get them into psychotherapy. We're doing group therapies. And the amazing thing is the veterans really like it. They feel supported. They feel like we've we've called everyone, like going up to 2 months appointments in the future. We're not already there yet, but we're making phone calls to make sure veterans know that all their appointments are virtual. We don't want them coming into the medical center. We want them to know we're here for them. So they can log on and we'll see them.
Oh, that's incredible. You're also able to do group therapy still too. I mean, because as we know, peer support and having your brother or sister on your left and your right, throughout this process with a clinician, with your frontline folks there, I think that's incredible and really a testament to how, you guys are really going the extra step, taking the extra step to be innovative during this time. And how, what's a good message from your standpoint as a practitioner to veterans and their family members on how to cope during this time? Like, what do you recommend as a professional in VA's mental health program?
Well, I would say the first thing is just starting with the virus itself. Follow the instructions. Limit your movement, keep your social distance, and wash your hands, wash your face, and so those are the things that you can control. So you want to keep that under control. And then the parts for your mental health, if you already are getting mental health care and you haven't heard from your clinician, reach out, make sure that you know how to get in touch with them. If you're taking medicines, make sure you don't run out. But we are here to support people even in between. And some people in their family situation, other family members may have difficulties. So people need people at this time. And even though there's physical isolation, there shouldn't be social isolation. So I think that, in this day and age, we can really connect with each other in ways that are so helpful with the virtual ways. People need to be thinking about ways how they're going to spend their time, ways to have a sense of peace. Again, managing their condition kind of in ways that they were already doing, but they're going to have new stressors come on board. And that's where one of my patients was saying how frustrating it is for her. She's done so well with get her recovery and getting her mood under control and going out and socializing, and then coronavirus comes along and it's like, well, how am I going to get through this? And so people will feel on edge. And I think what I want veterans to know is if they're starting to feel on edge, they need to reach out. They can reach out to their buddies, but we're also here for them. And if they're struggling, they can see us individually, in groups. And then we have nurses who are just making phone calls in between appointments just to make sure people are doing okay. Do they need their medicines refilled? We're just trying to really wrap around folks so that we can carry them through this. What is worse is if someone has both, if they get infected and then also their mental illness could get worse, or their mental health issues in their family, and there's that whole domino effect, which we really want to avoid.
Absolutely. And there's so many other items that they may need help with as well. Like we discussed earlier, we're seeing a lot of requests for financial and rental and utility and food assistance. And they can always ask us for help at Combined Arms. And, when you talked about social isolation and combating social isolation during this time and reaching out and doing that, we've had, as I mentioned earlier, we're trying to convert we have converted a lot of our in-person events in March and April into virtual events. So for example, in 20 minutes, our Christian affinity group that typically meets in person for a luncheon, they are meeting in 20 minutes online. And so they'll be able to interact with each other and keep that camaraderie going. We're also doing our Vet Connect Day, which VA will be out at or part of on Saturday as well.
We'll be on a little photo.
Yes, exactly. Yeah, it'll be one of these screens, and these screens have been so valuable in the last week and a half with the access to technology. So there's a lot we're trying to do as much as we can at the community level. But what's the fastest and most effective way to get in touch with your incredible teammates and professionals at VA Houston for veterans that need help during this time? Right.
So we have obviously they can just call the VA number 713-794-1414, and if that was correct.
I think it's 791-1414. Is that right?
I believe so, yes.
We'll put it up on the screen.
We'll get the correct one on there.
Yes, ma'am.
I don't call it, but
you're on the receiving end.
But there is another number which is directly to our mental health care office, and that is 713-794-7561. That we're answering that during the day, and that comes to our offices, and we will make sure people get to where they need whatever it is they need. It's fantastic what Combined Arms is doing, because this gets people a chance to be in the community, which is what so many people need to be doing, and they get a great experience helping others, and that's where veterans are. They know how to handle stress. They know how to help other people. And sometimes during that, the veterans have their own issues. It's real easy to help others. And so we want to make sure that all the buddies are saying, hey, you can still get your help. We're having family therapy, group therapies, as I said. And I have a great story from last night. They had an evening substance use group where the veterans were on it for an hour. And usually they don't want to go on to the second hour because they feel stressed getting here. They have to drive through traffic. And so the therapist said, this is the first time. Do we really, do you want to keep on? They go, yes, we love this. And this is so helpful. People
That's awesome.
who ordinarily wouldn't say a word were piping in, participating. And they felt it was so helpful, knowing that they had this support in their recovery, because we want people who are, if they have a substance use problem, we want them to weather this sober, because it's not them only who's affected, it's everyone around them in these homes. So families are going to be under a lot of pressure, especially if there's financial pressures. So we just want everyone, if you need something, there's you guys, there's us, and we'll all work together to figure out how to help them. We just all can connect to one another.
Absolutely. And I think telehealth in particular is like this experience will really be the case study that I think we needed in order to really further deploy telehealth and make that more available to veterans and their families.
It's going to be incredible for access to care, and especially our young veterans, a lot who take part in combined arms activities, people who ordinarily wouldn't, cross the parking lot to get into the VA are now, willing to call and have these appointments and work on their psychotherapy. They can see psychiatrists, they see social workers, psychologists, occupational therapists. There's also all their medical care that they'll be getting, and coordinating that as well.
It's important for working families and folks that can't get across town, or folks that are more rural in their location and can't get into town or can't access a community-based outpatient clinic or a vet center. So I'm really excited about the capabilities that it's opening up, and we will make sure that the veterans and anyone watching the video here and the interview here does have those phone numbers. And Dr. Marsh, I know you're incredibly busy. You've got a couple. You've probably got patients waiting for you, so I'll keep the rest of it short. But one last thing I wanted to talk about was our new partnership with the Bush Institute's Warrior Wellness Alliance, and which is essentially President Bush's vision to ensure that more warriors and their families get better access to clinical care through the peer network. So we know a little over 1 million veterans are involved in incredible organizations like the Mission Continues or Team Rubicon or Travis Manion Foundation, or they're involved in a Student Veterans of America chapter at their school, or they're engaged with Wounded Warrior Project and participating in their events and their programming. And how do we ensure that more of these individuals and their families access incredible clinical care at VA and other partners that are provided through the Alliance? So I know that we kind of recently turned it on, so to speak, here in Houston, and wanted to get your thoughts on what the impact of Warrior Wellness Alliance could mean if we get it right.
Right. That it's fantastic, because again, there's this idea that many people won't seek mental health care when they need it, and everyone knows they need it, but because they're embarrassed or they're self-conscious. But when you have the peers encouraging people and saying, hey, I got it, let's do it. And of course, with that, there's that triage system. And then you have your option of making sure that what the Alliance is doing is making sure people really get to quality care, not just someone who's happy to help you, but quality care. That's so important, because if you don't get the good experience, you're going to think, well, I tried that, it didn't work. We need people to get, it's like taking the correct antibiotic. So anyway, it's going to help more people get what they need, have healthier families. People will be able to keep their jobs, stay sober, stay out of trouble. So it's one more way to bring people together. The treatment doesn't work if you don't get it. And now we've got virtual care that's really, this is going to change how we provide mental health care and how people view it, and their accessibility. And having you still need the community to reach out and support people.
Absolutely.
And to say, hey, it's you want to get care. No one wants you to drive your car without getting oil in it. Sometimes you need a little oil that comes from the mental health clinicians. And so,
exactly.
So I think all these are, there's a silver lining to all this distress and stress out there. And I just want the veterans to know to reach out, ask for help, and we're here to help you, and we're here supporting people every day, and we're gonna all get through this together.
Absolutely. Dan, thank you so much. I think the beauty of creating a system of partners and a system of programs is now we're all able to refer bilaterally to each
Right.
other. So there's no wrong door.
Right.
There are hundreds of entry points now, be that your chapter leader at Team Red, White, and Blue that's part of the Alliance, or your service platoon leader at Mission Continues, or your responding to disaster here with Team Rubicon, or just generally getting involved in the Christian group that I mentioned that's meeting in 15 minutes online. So that's my daughter's coloring at the table. So this is the new normal of everyone working from home.
It's a family affair.
Yeah, yes, she's got the markers going, but I think that there's the value of that is that now we can refer directly into VA within 3 clicks, 20 seconds. There's their accountability built in for when VA sends clients back the other way to get involved in these peer programs, because that is such the social connectivity to one another is so important. That E4 Mafia, that Lance Corporal Underground, that buddy system, that peer support system, that I think that will help us get more veterans and their families better access to incredible quality care, mental health care that is being delivered already right here in Houston by Dr. Marsh and her team.
Well, and having all these organizations, what they do, and the Bush Foundation, they give that, endorsement, say, this is okay. It's a good thing. You can feel better. And what I learned from that group was they were doing a lot of bike rides and golf games and so forth. And they said, we really need to make sure folks are getting their mental health care. And this is the way to do it. So I was so impressed with the organization, how all of you have come together and have this set up. So it's one more way to just have healthy communities. Mental health is something we all need, and you can have a problem, but you can also have good mental health, and while you have it, and treatment work, support, maybe medications, education, getting skills, and we're doing all that. We even have our methadone program is still going. So
Oh, wow.
People who have substance use, I really want them to know that we are here to help them through this. They do not need to suffer. We're having an intensive outpatient program that we're doing all completely virtually.
Wow.
Amazing stuff.
It is. And I just want to say thank you again to you and your team.
Thanks.
I know we've been partners for several years now, and I know that partnership will only continue to grow and be more effective as we all continue to serve veterans in the ways that we do. But
it is our pleasure.
Yes, ma'am. Well, thank you so much, Dr. Marsh, for being on with us today. And for veterans and your families and organizations, please help us get the word out and make sure that we're combating that social isolation, make sure that we're increasing access to care and the incredible care that is now being delivered via telehealth and the innovative ways that VA is responding to this crisis.
Great. Thank you.
Thanks again. Have a great day.
You too. Stay safe.